Greetings. My name is Ruben Roberts. I am the CEO of RER Consulting. RER Consulting has two signature programs. One is Teen Talk, and the other is the COVID-19 Mental Health and Wellness Program. Let's Talk Mental Health is brought to you by the COVID-19 Mental Health and Wellness Program tonight. Tonight, we have a very distinguished guest, Dr. Delvena Thomas. Hey, Dr. Delvena, how are you?
Hey, hi. I'm well, thanks. How are you, Mr. Roberts?
I am well. I am well. Mr. Roberts is my father. You can just call me Ruben, okay? All
Okay,
right.
then.
Listen, I thank you for joining us tonight. I'm looking forward to this very fruitful conversation that we're going to be having. But before we get started, I want to do some a brief housekeeping information. So I want to just encourage everyone to come out and participate with the taking the survey for the COVID-19 Mental Health and Wellness Program. You can take the survey by going to the website. The website, if you look on the crawl, all of the information is there. It's mymentalhealthmiami.com. Once you click on that, mymentalhealthmiami.com, once you go there, up in the right-hand corner, you'll see where you can take the survey. Why is the survey important? Survey is important because you'll get to know your score as it relates to where you are in terms of stress, depression, anxiety, and levels of support, which is very important. Once you know those levels of stress, anxiety, levels of support, and depression, then you can do something about it. The scores are ranging from 0 to 10. The higher the score, the more you probably need to seek some services. And so, our once you get that information, you can contact our care coordination team, which is powered by New Horizons, and that number is 786-433-8487. So we encourage you to get your score by taking the survey, then contact our care coordination team if you need services. Now, New Horizons will provide, a multitude of services. It's not just about mental health. We understand that some of the services that we need are based on environmental factors. You may need something to deal with housing. You may need services dealing with employment. You may need something to deal with food insecurity. And so you can call 786-433-8487, and the care coordination team will assist you in that area. But first, take your survey so that you can get your score. So tonight, we're going to talk about a number of issues that deal with therapy from a cultural and linguistic competency perspective. And we have none other than one of the great therapists here in Miami-Dade County, serving Miami-Dade and Broward County, and probably many more places now since we have teletherapy. And we want to just make sure that you learn a lot from what she has to offer today. So, Delvena, tell me a little bit about how you got involved and how you got started with doing therapy.
Hmm. Okay. So I decided to go to medical school right after college, well, a year after college. I've always wanted to be, I was good in the sciences. I always wanted to be a physician, a medical doctor. And when I went to medical school, I thought that I was going to be a woman's doctor. I thought that I would deliver babies and be like, the female Mr. Huxtable. And I'm a kid. My parents are high school educated. They're from the dirty South, from Mississippi. I
All
really
right.
didn't know anything about medical school. I didn't know any black doctors, any black physicians. Um, and so I had no idea that OB-GYNs, besides delivering babies and doing pelvic exams and pap smears, that they perform a lot of surgery. I don't know about you, Ruben, but I'm a person who believes that you have to have God gifted hands to perform surgery,
Mhm.
to style hair, even. So, those two things, you need God gifted hands, because I can tell the difference between a hairstylist who has a God gifted ability to use her hands and do someone's hair versus a person who's like, oh, I need to make ends meet. Let me go to hair school and start styling hair. There's a difference. And so it's the same with surgery. And I know there are some people who become surgeons who don't have good surgical hands and don't know what they're doing in the OR. And I didn't want to be that person. So once I realized my first year of medical school that I didn't have surgical hands, I started thinking of other specialties. And so as a medical student, I was doing a rotation at the University of Maryland in Baltimore on an inpatient psych unit. And this is, these are real psych units. Our state hospital is a real state hospital. We have some chronic mentally ill people, some severe schizophrenics, severe people, severe cases of schizoaffective disorder. And I remember working with this patient, and I had the utmost empathy for this patient. And the empathy was because, number one, I recognized that there's no cure for the mental illness this person displayed. Number two, there's no cure for the mental illness this person displayed. And number three, there's no cure. And so, how can you not want to help society when it's that way? Not want to help the common good, the people in your community. And then I also recognized, and this was in 2002 when I started my rotations, 2001, 2002. I also recognized there were no Black psychiatrists. There
Mm.
was one or two Black psychiatrists. They both worked at the VA in Baltimore. And there weren't a lot of social workers and therapists. And at the time,
Not
that was
even at Johns Hopkins?
so
See?
I was in the University of Maryland system. Um,
Okay.
yeah, so a couple of my colleagues, they ended up at Johns Hopkins doing fellowships in child and adolescent psychiatry. So
Mhm.
they started that trend. We have more and more brown and black and brown people who are going into the medical field. But at
Right,
the time, we're talking 20 years ago, mental health was not trending the way that is trending now.
right.
People were embarrassed. There was a huge stigma in the Black community. There's still a stigma,
That's
but
right.
because some celebrities and athletes have talked openly about their challenges, it has become something that's a little more accepted. However, there's still some barriers. So I felt a lot of empathy, and also I just felt like I just thought about a lot of different things: retirement, um, what the work would be like for me, what I could do as a psychiatrist in terms of helping the community, helping my people. There were a lot of financial decisions that went into that. And I also felt like I was a great person and I had great skills to be someone that's focused on mental health issues. God has given me a lot of insight. So most of what I know and most of what I do, I speak from my spirit and from my heart. So it's not what I learned in residency or learned in medical school, but it's what I was born with.
Wow, thank you for that. That definitely gives us a lot more insight on how you chose. But the thing that really stood out about what you said is that you were in the psych ward. And for those of you, and I'd like Dr. Thomas to really explain to you the difference between, when you have folks who are psychotic, I
Hmm.
mean, severely mentally disturbed,
Hmm.
versus those folks who have, that are not on that deep end. And I'd like for you to talk about it. What I love about what you said was that you had empathy, and I think that's a very important characteristic for any therapist that's working with folks who are dealing with mental issues, whether it be something that is not so severe, or whether it be something that is very severe, bordering on psychotic, or folks who are having some severe personality disorders, or what have you. And so talk to us about the difference and the range of diagnoses, and what are some of the things that we need to be aware of as it relates to ourselves or family members, so that we can pay attention to that, to know that, hey, maybe I really need to go and see someone.
Ooh, that's a loaded two-part question. um, okay. So the first part is there's something that I say: there is nothing worse than a diseased brain.
Mm,
People in the lay land, folks who are not mental health professionals or not clinicians, or I won't even say clinicians, you got to be entrenched in the mental health field, and you got to be entrenched on a level to where you've seen the pathologies of man. Mm-mm-mm. So, my first job out of residency was the Federal Bureau of Prisons. I came to South Florida to be the chief psychiatrist of the Bureau of Prisons Southeast region. I was covering down the detention center in downtown Miami, the facility in Perrine, Florida, a facility in Talladega, Alabama, a facility in Yazoo, Mississippi, the penitentiary that was in, and the medium that was in Atlanta, but that soon became a medium. But initially, it was a pen. The penitentiary in Orlando and the complex. So for me, it was intriguing to talk to these people who had this unbecoming way of thinking and living. And I wanted to understand the brain of someone who could kill another person. I wanted to understand the brain of someone who could drown her children. I wanted to understand the brain of someone who just, show total disregard for societal norms. And so for me, mental health was intriguing, but also it was very fulfilling because I was able to talk to people who people don't understand this. You are a product of two things: initially, your environment, as well as your choices. Now, when it's your environment and you choose not to make healthy choices for yourself because you resign to the notion that there's nothing you can do about your life, it becomes you're a product of your choices. At times, there are some folks who are born into an environment and they haven't learned how to deal or how to cope with those things because things were dire from day one. They were born into a family with maybe a mother and a father who were pathologic, who were very abusive. Maybe they were born to one parent who was that way and there was no other parent. And there's so many examples we could use, right? Jeffrey Dahmer is an extreme example. But there are several examples of folks we can use who are just right down the street in Overtown, Liberty City, and actually in Broward County, all over. So you're a product of your environment, but you have an option to make choices. We only have so much time, so I'm not going to give examples of being a product of your choices. But at some point, once you acknowledge that you don't have to stay the same, that you don't have to remain in the situation that you were born into, or you can play the hand you were dealt, right? Because you can hold them, fold them. You can play it. You can play the hand you were dealt. So people don't understand how extreme a diseased brain can be. It can be extreme. You mentioned personality disorders. That's something I try to teach people about borderline personality disorder. I saw a lot of that when I served my tours with the military. I'm also in the Army Reserve. So I conducted a lot of therapy sessions for men who were married to women with borderline personality disorder. And when I tell you these women were destroying their world from afar. Like, they had issues before going downrange, but once they got downrange, it was amplified, times a million. So, besides the psychotic disorders like the
So,
schizophrenia,
so hold up. When you say downrange, please explain what that means when you say downrange before
in
they
the
went
combat
downrange.
zone, combat zone.
Okay.
So yeah, you're basically war is not fought the way it used to be fought, right? We talked about um forward operation bases, being on the front line, things like that. When you go to places like Iraq and Afghanistan, everywhere is considered a battlefield because you don't know when that incoming is coming. When I was in Iraq, we got an incoming my first night there. I didn't sleep the entire night. I took like
Mhm.
200 milligrams of Benadryl and still had to go to work the next day. So downrange means in Iraq and Afghanistan. Now there's no Afghanistan, there's no Iraq. Now it's just mainly Kuwait, but Kuwait is not considered a war zone. So at the time, downrange was in a war zone. It was Baghdad, it was Afghanistan, and to sit and to try to help these people understand the pathologies of their significant others who were back home. It was just very fulfilling for me to teach them about something you just never learn about. No one is raised in their household with a non-medical parent or non-mental health parent learning about personality quirks and maladaptive traits. You don't
Right.
learn that.
Can,
So it,
can you can you give us your, because I think that people still don't fully understand borderline. Can you give us a brief description? And I know you probably got a good one. I got a couple, but can you give us a brief description of how it presents? Someone with the borderline characteristics, if you will.
I'll tell you the first thing one of my attendings told me during residency, the patient that makes you just every time you're around them, you just get this ugh, this sensation in your stomach. You don't want to be around them. They just make you want to crawl into yourself or just, to leave the environment. You don't want to be around them. They make you feel very uncomfortable. They make you and people may say, okay, that's a patient and you feel that way, but this is how they make you feel. They conjure very negative feelings from you.
Well, they
Very,
do both, right? Because I've had patients. This is what was my first experience, and when I was doing supervision, when I was being supervised, and
mhm,
so uh, they would come in and say, "Oh, Mr. Roberts, oh, we had such a great session last session. I really appreciate you. You really get me better than the other therapists I had." And by the end of the session, I hate you. I'm never coming back again. And the reason why they talk about the borderline is because it's like these, there's these multiple characteristics. It's like if you just put all these different diagnoses or in a bag, and this person has all of these things
mhm,
that's going on. And what happens is they're very borderline folks are very characteristic where they really can connect with you. But then again, there's those other extremes. So I mean, that's what I was thinking about when I hear you talk about borderline, and then folks don't understand it. You're thinking, hey, my relationship is good, everything is going good. And then the next minute, it just went from 100 to zero, and you
yeah,
don't
from
understand.
heaven to hell.
Yeah, from heaven to hell, right?
Yes. And like you said, they're extreme. Everything is black or white.
Right,
Everything is right or wrong,
right,
good or bad. There's no gray, there's no in between. And
right,
nothing is ever their fault.
right, 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 right.
Nothing is ever their fault. And I tell you, a red flag for me is a patient who comes in and says, I was diagnosed with bipolar, depression, generalized anxiety disorder, panic disorder,
Yeah,
um,
that's it.
substance use, all this. They have all these diagnoses.
All of these diagnoses, exactly.
The clinician is usually not savvy enough to diagnose a
Nope.
personality disorder.
Right.
And these quick clinicians that we're cranking out, they don't get it. They're not intuitive. They're not insightful. They're not going into mental health because of a desire to help people, but oftentimes it's about money. And especially during COVID, a mental health professional has become the trending profession, whether it's a psychiatric nurse practitioner, a licensed mental health counselor, what's the other one? A licensed professional counselor. LCSWs have to work supposedly. Now, I've never been a licensed clinical social worker. I've never been an LPC or a psychologist of or any of those things. But when I talk to folks who are non-medical doctor mental health professionals, folks would choose the track. This is what I've been told by people, because they already have a master's degree in something. They can get their license in mental health counseling faster than if they go down the clinical social work track. So I just had a conversation with a young lady on my podcast the other day about becoming a licensed clinical social worker. So a lot of these people who are being cranked out quickly, most of them have degrees as licensed mental health counselors, licensed professional counselors, and a few are licensed marriage and family therapists. And so there are few licensed clinical social workers. Few.
So, so now you brought up some very good points. So again, one of the very strong characteristics that you displayed earlier when you talked about what made you get into the field is when you were going through your rotations, and then you went to the psych ward, and then you had so much empathy for these folks who were really stuck,
Mhm.
through medication and probably some talk therapy, but mostly heavily when they're at that level of severity is mostly medication management.
Oh
um,
yeah,
that's going to really keep them subdued.
yeah,
So
because they're so regressed, they can't process
right,
psychotherapy. Yeah.
right, right. So now, what what do you recommend? You just talked about how you have folks who are in the field, but they may be in the field for the wrong reasons. So I'd like for you to speak to our audience about how they can look for a therapist. What should they look for in a therapist in terms of receiving some types of services? Because you may be feeling off. And
Mhm.
those of you who are watching today, I encourage you, if you just feel off, if you feel like you have low energy, don't want to get out of bed, drapes are drawn, you might be feeling depressed, or if you notice that you get very excited about anything, the least little thing, or you're worried about the least little thing, you may be a little anxious, and you may be able to resolve some of these issues because they're not so severe by speaking to a great therapist. And
Mhm.
so, Dr. Thomas, what would be some of the characteristics that you would recommend for our listening audience for them to look for in a good therapist?
I'm going to piss a lot of people off by saying this.
Go ahead and do your thing, Dr. Thomas. Go ahead and do your thing. Go ahead.
So, therapists who don't take, or mental health professionals who don't take insurance, are not doing any justice for our community.
Mm. And why is that?
The reason why I say that is because the average Black person may not be able to afford out of pocket rates to see a therapist or a
Okay.
psychiatrist or a mental health professional. And if you don't have a sliding scale, if you're someone who takes self pay only, you're in it for the money. You're doing a disservice. So at DRT Behavioral Services, we take all healthcare plans, all the plans we were able to get on the panels for. The way panels are set up, what patients don't know is you have to apply to be credentialed. If that panel is saturated, if they have several psychiatrists, which they never do, but if they have several psychiatrists or they have it set up so that they're contracted with a certain mental health professional to provide their services, that panel may not be open to you. So there are a couple of panels that we don't take. One is Ameri something. I can't, oh, I'm blanking on the name of it because we don't take it. It starts with AMERI. We don't take it because they did not accept us on the panel. And also, it depends on where your office is located, your geographical location. It depends on your discipline. They may have several licensed mental health counselors, so they don't need any more. They may have several licensed clinical social workers in your catchment area, so they don't need any more. Telepsych has changed the game quite a bit
Yeah.
because now you're not, people don't have to come into your office, so you can provide services wherever you're licensed, whether it's Florida, California, New York, Maine, wherever you're licensed,
The whole state, the entire state.
the entire country if you want to. I have a friend who has 14 licenses in the country. She's
Mm.
licensed in 14 states, so she provides telepsych in all of these 14 states.
Okay.
As a psychiatrist, she's a child and adolescent psychiatrist. So, what was I saying? Yeah. So most folks are using, most average people have insurance. They want to use their insurance. So to say to someone, I don't take insurance, you have to pay the self pay rate. If you're someone who only takes certain plans, I get it because again, sometimes you can't get on a plan like Blue Cross Blue Shield New Directions is not super receptive or kind to folks who are not psychologists or not psychiatrists. So sometimes it's not you that's making the choice not to accept the plan, it's the plan itself, the insurance panel. So DRT Behavioral Services, we accept just about every plan. We accept a lot of Medicaid plans, which are based on need. We take Medicare, which is the federal insurance for disabled and elderly folks. We take, all of the Optum plans, AvMed, Oscar, all of the Optum plans, including the Medicaid plans. We take Aetna, Blue Cross, Blue Shield, Cigna, TRICARE, which is the military folks. So we take almost every plan we can because we want to help people and we don't want to turn people away and just say, we only take self-pay. Even when Blue Cross was paying $2, I'm, I'm exaggerating, but Blue Cross had a very low reimbursement rate.
Reimbursement
No
rate.
one was taking Blue Cross when I opened my private practice, but me, pretty much, and maybe Dr. Portier, Joseph, another psychiatrist, another couple of psychiatrists, but most folks weren't taking Blue Cross Blue Shield. So you want to find someone who takes insurance because their commitment to being able to help folks who are insured is important. And if you don't have insurance, you don't have money to pay the self pay rate, just say it. Or if you have a plan and it has a high deductible and you want to work something out, say that because clinicians can't read your brain. We can't read your mind. If you can't afford it, just say it. And the other thing is, you want someone who will give you 5, 10, or 15 minutes to just do a free consultation and listen to your case. And I know folks are like, I don't have time to do that. Every person who emails me, I email them back. I may not talk specifically about clinical stuff in that email. I'll say, if they don't give me a phone number, can you give me a contact number so I can call you? Or I'll give them the office number and say, please call me so we can discuss. I'll give them a little bit of time to tell me about their challenges, and then I disposition the case, whether it's referring it to a therapist in my practice, to one of our psychiatric nurse practitioners, or my psychiatric physician assistant, because I'm pretty much capped out on my cases. Or if it's referring someone outside of my office, I think I have built a pretty good um, village of mental health professionals, white and black,
Right.
Hispanic, non-Hispanic, men and women. And
Right.
so there's enough for everyone out here to eat. And whoever I refer you to, they will be someone who shares in my same values. They have empathy. They're not trying to get rich off of folks. They want to help. They want to help you process, and they have the skills to provide you in psychotherapy. When you go see a therapist, you should not feel like you're talking to your neighbor. You shouldn't feel like you're talking to your grandmother. You shouldn't feel like you're talking to your mama. It should feel like a therapeutic setting. There should be professionalism. There should be some rules that are implemented when you start the psychotherapy with your therapist. They should tell you or give you even a contract to sign. So this is an official thing. It ain't just having a cup of coffee or tea with your homegirl. It's an official thing, and you're doing work, and you should feel like there's some work. And when you feel like there's work and you get pushed to the brink, don't give up. Don't say, oh my gosh, like what you were saying, Ruben, about the patient who you challenged that person in session. So people don't like to be challenged. When they don't want to be challenged, they step away or they fire you. I'm good with it. I've had a patient fire me because she didn't like me therapeutically confronting her. But I told her, I said, this, you don't understand it now, but this is a part of your process. When you go to the next therapist, if it's a savvy person and you tell them you fired me because of something I said to you, they'll understand it.
So let me unpack because you gave a lot of information, and so just for our listening audience, some key factors. Definitely, you want to make sure that you have someone that's empathetic. You want to have someone that's going to give you a consultation, at least free, just to get a good idea of where you're having the challenges and that sort of thing.
Yep.
And then you want to have someone that's willing to take whatever insurance that you have, because we know that paying out of pocket can be, cost prohibitive.
It's a
So,
recession out here.
right, right. And so the other thing that I think Dr. Thomas mentioned that's very important is you have to have boundaries. Any good clinician, any good therapist, any good practitioner or doctor make sure that there are boundaries that are established in their sessions.
Yeah.
Because if there are no boundaries, then you're feeding into whatever the psychoses or whatever the issues may be.
Yeah.
And you can make matters worse. And this is something I want folks to know that you can see someone and you can actually deteriorate if they're not good at their trade.
Yeah.
So I'm not going to highlight the negative. I want to just say these are the positive things that you need to know. And the other thing is, to me, in my estimation as a family therapist, most good practitioners that I know recognize that you have the answers and they guide you to the answers, but
Yep.
they don't give you the answer.
Nope.
And I think that one of the things that people get frustrated with is they want one or two things: is they want someone to give them the answer, or they want someone to accept whatever their view is.
Hmm.
If you're not accepting whatever their view is of the situation, then they feel that you're not doing your job well. And
Yeah.
so, in order for you to be able to go to a therapist and receive any services, I want to say to you that I think that the first thing that you have to be is you have to be willing to do the work.
Hmm.
And that's where that consultation comes in. So if you're not willing to do the work, I don't care. You can have the greatest therapist ever. But if you're not willing to do the work, then that therapist can't guide you to a place to where you can really make some positive changes in your life. So having a therapist that really is empathetic, that understands you, from a culture perspective. So they have to not only they have to see you, hear you, respect you, understand your culture, your language, that sort of thing. They have to make sure that they set boundaries for you. So these are the characteristics when you're looking for a therapist to work with that you should be looking for. The last thing I want to say is that if a therapist has those characteristics, then I don't believe in ethnic matching. If they are truly uh, genuine and they are authentic and they have that, I don't think that you have to have or they understand you from a cultural perspective. I don't believe that you have to have a therapist of your same ethnicity. I think that you have some therapists that can work with you and treat you regardless of your race because they have those characteristics that Dr. Thomas described and that are important. However, I think it's always a plus to have someone who has of your ethnicity because they truly understand. So I want to talk to you about, and Dr. Thomas, about how you talked about being in the military. You talked about just dealing with the mortar, the fire, and that sort of thing. But in the military, it's a very hierarchical system,
Mhm.
and it's also a system that has been known to be racist.
Mm.
And I think that a lot of the issues that some minority people face on a regular basis that feed into mental illness, because you have to understand the historical trauma, and I want you to talk about that, how that historical trauma plays in, but in the present, how those microaggressions, how they even just take it to another level. So you're already dealing with things that your family had to deal with from a historical perspective, and then you have to deal with the microaggressions that you deal with every day. So talk about how that actually plays out in terms of just our stress, depression, anxiety, and and how do we how would you suggest that we deal with this, because sometimes we're not even aware. We've been taught to just accept it, man up or woman up. Don't be the angry black person. Like, your feelings don't matter. You don't have a reason to really be angry when these things are happening. So what is your feedback on that? I think that that's something that is very important for us to discuss.
I'm coming right back. I came to grab this.
Oh, 60. Okay. Yes. The 1619 project. Yeah.
Okay. Listen, if you didn't have Black History class or you didn't pay attention to it, you must. You got to get this book. This is all of our history, most of it right here. I had a great Black history class growing up. I grew up in Maryland for the most part. I was an Army brat, so I moved around a lot. And so the system that you spoke of, the military and the racism, my father lived it. He was an enlisted soldier. He joined the Army at 21, and that's how he got out of Mississippi with my mother, and the army afforded them the opportunity to live overseas. They went to Okinawa, Japan, where one of my brothers was born. They lived in Jersey, they lived in Kansas, they moved to Germany for 5 years. So my mother was this little Black girl from Jonestown, Mississippi, and my parents were global in their early 20s. My mom was 18 when she and my father married. So in her late teens and my father's early 20s, they were global. And so I think that has a lot to do with why I love to travel so much, because I lived in Germany for 5 years, traveled around with my father, my family being in the military, and I heard the stories about the racism, which was much worse in the 60s and the 70s and even in the 80s. More so for me, what I experienced in the military, because the way it is this: when you're a medical doctor, you're in the medical corps, you have your degree, no one can take that away from you. You get what you get because it's a guarantee in the military when you're a physician. The thing that I had the most challenges with was the sexual harassment, not the
Mhm.
racism. I had white um, supervisors, people in leadership positions, white men who would say inappropriate things to me. But I knew how to handle that. So it for me, it never rose to a level of needing to go to EEO or speak to a counselor, whatever, because I would deal with it myself and I would never have an issue. So I had more issues as a medical student with racism, as a resident training in psychiatry. And I would everyone has their own personality, they have their own ways of dealing with things. And my mom used to tell me, people will only do to you what you let them. People will only do to you what you let them. And it's not fair to apply that to a person who may have been raised in a very passive household, because we are a product of our environment, right? So my mother wasn't passive, neither was my father. So I'm not a passive individual. My mom used to tell me all the time, you're such a free spirit. So I'm the person with the big mouth. You ain't going to abuse me. You ain't going to discriminate against me. You may do it, but I will have something to say back to you. So, what I would tell my brothers and my sisters in dealing with racism, emotional intelligence, and also with dealing with sexual harassment, emotional intelligence is all of our friends in every situation. And there are some things I had to really um, work on my emotional intelligence and handling, like handling things in my own household with my son. You know, emotional intelligence is the way that you process your emotions, the emotions of people around you, how you handle the situations that occur for you. And it also means things like emotional multitasking. When you're angry or upset with someone, don't take it out on the next person. You know, that's emotional intelligence as well. So, in dealing with the racism, the imposter syndrome out there, some folks really need to go to psychotherapy to process it, and also so they can learn confidence. When you're lacking confidence, that's not a good combination, to lack confidence and to also have someone who is harassing you in any way because of your skin color, your gender, whatever it may be. So some folks may have to go into a formal psychotherapy setting to get help with that. But if you're someone who, you know, you have confidence, you know who you are, you're able to interact with people, and there's no hesitancy in you interacting with a person. Sometimes you got to handle certain challenges one on one. You know, you don't do it in the boardroom or in the C suite, or you handle it one on one. You just tell the person, hey, I want to talk to you about something. And you pose everything as a question. You know, you're not accusatory. You say, did it seem like when you said such and such, did that seem wrong to you? Or you talk about the way something made you feel. The other day in the meeting, when you said, I look like that gorilla on TV.
Mm.
Sorry. That actually happened on the news recently. And I can't remember which city. But you pose a question or you say how something made you feel to help the other person understand that. Because there are some characters where what you say to them, they'll try to flip it and make you seem like you're the paranoid one. So, and if you're in a work environment where microaggressions are always occurring, write. Keep a journal, write the date, keep notes. And if you have it, if you're in a big enough company or organization, there will be an EEO counselor. But just write everything down, because a person who can reference their journal or their notebook and give dates and times, you will be seen as a reliable historian. You'll be seen as someone who's reliable, that you're not conjuring things. And I was just a part of a case where a man who worked for Miami-Dade County was discriminated against, actually, by a Haitian man, a black Haitian guy, and he sued the company and won. I was his mental health expert. He sued and won because he wrote everything down. He sued on the basis of post traumatic stress disorder, PTSD. So there are things that you can do, including, you know, besides the psychotherapy. If these insults continue to occur and they escalate, you want to write things down and seek psychological help, because that will come into the picture if there's ever some sort of court hearing or if there's some sort of legal action.
So I like the fact that you mentioned that microaggressions don't have to happen um, exclusively from folks from different races. It can happen from folks from the same race, maybe different ethnicities, but same race.
Yes,
And
sir.
so we have a lot of tension, and
Mm,
we have a lot of, again, when you look at the historical trauma, That's the PTSD, when you look at the historical trauma. And we have a lot of unresolved issues. It
Yeah.
seems as if your agency covers a broad swath of psychiatric and clinical services. Can you tell us a little bit about your agency, the services that you provide, how you can be reached if folks want to contact you?
Yep. Yep. So DRT Behavioral Services, Brain Love. That is our organization. It's a for-profit private practice. I'm the CEO, pretty much. You shall say, but we also have a nonprofit arm where we raise money. I would say, indirectly for different things. We raise money on social media. People will send in donations. It's called DRT Brain Love Foundation. We've used it to help folks who, someone transitioning out of prison, a woman who didn't have insurance and was pregnant and was suffering from postpartum depression, someone who says, I can't afford my copay today, or someone who says, I have a high deductible and can't afford. So if you talk to us, we do our best to try to meet you where you are and to compromise and get folks seen. So we have different providers. They all pretty much share in my the energy that I have. Everyone has empathy. Everyone loves people. Everyone loves mental health. Everyone who works here loves the brain. Um, we all have an appreciation for how important the brain is in our lives. It's Black owned, veteran owned, woman owned, and everyone who works here is a minority. We have three psychotherapists. We have um, eight psychiatric nurse practitioners and also a physician assistant who I trained in mental health. She's also in the military. She's a major in the Army Reserve. And we also have a wellness spa. That's in addition to our main office. It's in the same building. In our wellness spa, we do massages, facials, eyebrow tinting and tattooing, eyelashes. We also have a weight loss program that we run. So some of these things where we had to kind of go easy on during COVID. We could not really do those things because we were all in quarantine, but we're getting back into providing a lot of those services still. The mental health services are virtual still. We are not seeing anyone in the office. Everything is virtual, conducted by video, but sometimes patients say they don't want to be seen on video and they may opt for the phone. But certain plans will require that you see them by video. So sometimes they'll show up in the video and they'll turn the camera off, and there's nothing you can do about that. But we provide services for all mental health issues. We have folks who see adolescents. We did have someone who was seeing children, so under the age of 13, but that person is capped now, can't take any new cases. And so, we just want everyone to be happy, to live life, to appreciate life, and to love themselves. And an extension of that is our CBD program. So we sell CBD products, and we also well, I do the certifications for medicinal cannabis. And recently I created a pamphlet with the help of Alfrena Musa, who is a Black artist in Miami Gardens. And it's a brain love pamphlet on food and one on sleep to talk to people and teach people about the effects of sleep hygiene, ill and positive, as well as the effects of food, what you eat, your diet, and your intake, how it affects your mental health and wellness.
Again, Dr. Thomas, thank you so much. I mean, you always give us, a great perspective of how to deal with, creating a healthy environment from a mental perspective, how to do the self-care, how to take care of us, but most importantly, how to make sure that we take care of our brain. There's so much more I want to talk to you about, but we don't have the time tonight. So maybe we'll
Yeah,
have a follow-up session
it's a
about.
lot.
Yeah, it's a lot to talk about. So I want to talk about just dealing with the mask. I want you to really unpack that imposter syndrome that I think a lot of us are dealing with. And I want to talk about just relationships issues in general, and how we can move beyond some of these conflicts that we have, from the violence that youth have on each other, into the issues that the men and women have. And knowing that we should be seeing ourselves as a force together as opposed to a force working against each other. But I want to thank you so very much for joining us tonight. Can you give your phone number and your email, I mean your website again, so that folks will know how to get in touch with you?
Sure. I'm sorry I left that out. The office number is 305-981-1700. Again, 305-981-1700. And the website is Brain Love Help. So that's Brain, BRAIN, Love, LOVE, Help, HELP.com. And we're on social media, Facebook and Instagram as DRT Brain Love as well, and Twitter.
Thank you so very much. Listen, you just got a lot of information tonight from one of the best that we have here in South Florida, Dr. Thomas, Delvena Thomas. I think that those of you who want to inquire further, you have her information. This is a rebroadcast, so it'll be up on our social media pages. You can always visit it. If you didn't write down the information, you can always play it back and get her contact information and reach out to her. I think one of the greatest attributes that she has as a therapist, as a clinician, as a doctor, is just the empathy and the willingness to serve folks who are in need. Again, this is Ruben Roberts with the COVID Mental Health and Wellness Program. I want to encourage you to come out and take the survey. Go to mymentalhealthmiami.com, hit the right-hand corner where the survey link is, get your score. You get your score, that'll give you a score in where you fall in terms of depression, stress, anxiety, and levels of support. And once you get that score, if you're scored high, or if you just want any other information about resources, contact our care coordination team at 786-433-8487. That is in the scroll. I thank you all for joining us this evening. Stay tuned for next week on our next Wellness Wednesdays, when we'll have another special, exciting guest. And please make sure if you have any comments or question for Dr. Delvena Thomas, to put them in our chat on the social media page. I'll make sure that she gets that information. And if there's enough interest, we're going to make sure that she comes back. She's going to come back anyway, but we want to make sure that we can come back and we can have some more dialogue about the very important issues that we deal with on a daily basis. Thank you all, and I bid you all good night.